So our presentation is titled Midwifery, Not Medicine, and it focuses on the factors that contribute to the success of maternity care in Scandinavia. So Scandinavian countries are consistently ranked as some of the best countries in the world to give birth. This is manifested in low rates of caesarean section in comparison with the rest of the developed world, as well as lower rates of preterm birth, low birth weight infants, and maternal morbidity and mortality. So what is so special about maternity care in Scandinavia? In Scandinavian countries, midwifery is a central feature of maternity care. Midwives are the primary maternity care providers, and continuity of care is implemented at a higher rate than other developed countries. In addition, policy at a government level reinforces the success of maternity care in Scandinavia.
So in terms of their role in maternity care, the Nordic midwife has evolved into a unique profession with advancing skills in clinical areas and scientific education. Denmark, Sweden, and Norway have become pioneers in the education of midwives, and Sweden has moved toward midwifery care being the only care available to women unless requiring medical input, which is free to all eligible women as part of the state healthcare benefits. Although in Sweden it is a requirement to study nursing prior to specialising in midwifery, it has since expanded its midwifery education to include prescribing rights of contraceptive drugs. As well as this prescribing responsibility, midwives provide all maternity and women's health education and contraceptive resources. As is expected of all maternity service professionals, Scandinavian midwives build rapport with women and their families, also providing a safe and secure environment to promote woman-centered care and trusting relationships. Scandinavia has successfully created an autonomous midwifery professional, which is in equal standing with appropriate medical care as needed, and this being a key component in optimal modern maternity care services. So how do they compare to the rest of the world? It is widely recognised across the globe that Scandinavian countries are leading the charge for normalising maternity care, focusing on low-risk pregnancy care and natural processes for labour and birth. When compared to North America, Scandinavian midwives provide maternity care, whilst obstetricians are generally hospital-based specialists who provide tertiary level maternity and medical care. In many instances, Scandinavia is minimising the medicalisation of pregnancy with a really strong push toward normality and trusting the body's natural processes. So for example, for healthy women under the age of 40, routine blood tests and one ultrasound is all that is ordered, and no gynecological examinations are performed unless it's deemed a medical requirement. In Scandinavia and the Netherlands, midwives are providing all prenatal, intrapartum, and postnatal care for at least 70% of pregnant women, which is contributing to the drastically lower obstetric intervention rates as opposed to North America. And as you can see on this presentation, mortality rates are exceptionally lower in Scandinavia, which has then been linked back to the excellent maternity services and midwifery support.
So government policy is another key contributor to the success of maternity care in Scandinavia. Here, substantial paid leave for both parents is a key component. By providing the opportunity for both parents to be at home during the early transition to parenthood, women are more supported and experience lower rates of postnatal depression. Another major contributor to the success of maternity care in these countries is the low cost to women and their families accessing these services. In fact, the majority of maternity care in Scandinavia is free. This increases the accessibility of such services and ensures that women are able to access high-quality care regardless of their financial or socio-economic status. This is a stark difference to the cost of maternity care in other developed countries. For example, in the US, where the maternal mortality rate is highest among developed countries, a 2015 study found that the average estimated cost per maternity stay ranged between $1,189 and $11,986.
So finally, the recommendations that can be made worldwide are linked to the high standard of care seen in Scandinavia, which really should be a universally acceptable for all women, regardless of their geographical location. As such, the two main recommendations to increase the standard of maternity care across the globe include, number one, strengthening the midwifery workforce as a whole, And number 2, contributing to policy changes to improve maternal and neonatal wellbeing. Thank you so much for listening.